Okay, so this morning I'm with Rachel Birks, who is a mental health nurse who also manages the mental health services in Stoke-on-Trent. Very busy lady. Okay, Rachel, can you tell me when it was that you were at CCSC?
I was at CCSC from 1991 to 1995. Gosh.
1995. Oh, right. Yeah, a couple of years. Yes. You remember? Will you remember Mr. Swindle's being there when you were there?
Mr. Swindles was just there as I was leaving, I think.
Right. Okay. So you saw him as a very young man.
Yeah.
Excellent. So can you tell us a little bit about your job and what you do? I mean, obviously you said I said you're a mental health nurse. What does that kind of entail from a kind of a day-to-day point of view?
So my background is a mental health nurse, working, and so I suppose all of that time I've worked in hospital settings and inpatient wards, and then within the community. I'm obviously now a senior service manager, so even though my background is mental health nursing, I now manage a number of community mental health teams who deliver services, of which some of those members of staff may be nurses, but they may also be other different types of professionals as well.
Oh, right. Okay. Well, that leads me actually into another question I was going to ask. What are those different roles that kind of form part of the overall service?
Okay. So within community mental health services, I obviously work with other mental health nurses. There's occupational therapists, physios, consultant psychiatrists, specialist registrars who work within mental health, social workers, healthcare support workers, STR workers, and then obviously as well, there's also, people who work within an administrative role, so reception staff, those types of people. And then I suppose also within some of my teams, I also work closely with people who work from a finance department point of view, or may work within our IT and data analyst perspective, and that obviously people who are really good at IT and those sorts of things are well needed now within the NHS. So it's a really varied scope of people really that I work with.
Right. Okay. So yes, I mean, you're talking about, so you've got a lot of people on the front line, but also kind of back office who provide support and keep the wheels turning. Brilliant. So can you just talk me through your can you talk me through your kind of journey to where you are now in terms of what courses you've done, what qualifications you went to complete, that kind of stuff?
Okay. So obviously when I was at CSC, I completed my GCSEs. I didn't, I successfully, I think, passed a number of them, but I didn't pass my maths. I got a D in maths, and didn't go straight to college. Left school, didn't go straight to college, decided at around 19, 20 that I wanted to go back to college. Didn't take the normal A-level route, actually completed an access to higher education course at Newcastle College for a year, which is equivalent to A-levels. Yeah. Also at that same time redid my GCSE maths to gain a pass within that, and then went off to Keele University, and I was one of the first degree students for nursing at that particular time.
Oh, right.
It had just changed from a diploma to a degree.
Very cool. Yeah.
So I completed my 3-year degree in mental health nursing, and obviously part of that is actually working on the ground. So it's not very, it's 50%, sort of theoretical, 50% working, which suited me much better. I don't profess to be any sort of, a great scholar. So I went to university. I've completed that.
Yeah.
Finished my degree. Obviously, was then qualified as a nurse. So I've worked all over, and then recently. I've just completed my Masters in Business Administration at Staffs Uni.
Oh, right. Okay.
So I've just completed a Masters.
Brilliant.
As well. But that's more business focused.
Yes.
Completely different.
Yeah, I suppose with your role from a management point of view, you need to have that skill set as well.
Absolutely.
Can I just ask you, what, as a mental health nurse, so I suppose more frontline, what would you say would be the best part of your job?
Oh, absolutely working with service users and working with carers. Yeah. No day is the same. There's so much, you know, it's very fast paced. I love the fact that you can work in one particular area for a very long time, but you never become a master of that.
Right.
It's something different every day. You're learning something different every day.
Right, brilliant. And I mean, the flip question to that is, what's the hardest or most challenging thing to deal with, do you think?
I think it can be the fact that often you feel that change is very slow. Right. Okay. Whether that's change, you know, for people, or whether that's change around a service, and you know, there's much more work going on around mental well-being than when I very first started as a mental health nurse. Right. Okay. But that change has been very slow. Yeah. But I definitely I think possibly, you know, the working hours and you know, is often something as nurses, you work very long hours and often sociable hours. So, you know, Christmases you work, you spend a lot of time away from family, but then on the plus side, something that's very fulfilling. Yeah.
Oh yeah, I can imagine it is.
So it's a balance.
Right. Okay. Brilliant. One final question from me is, if you hadn't gone into mental health nursing, what would you have liked to have done?
Oh, well, I suppose I've been really lucky because I've always really enjoyed the business side of the NHS, which often people don't necessarily see. And, you know, so I think the fact that I've gone into nursing and I've sort of diversified now into being more operational, that, you know, that possibly would have been something I would have gone into. Right. Instead of nursing, from a business point of view, particularly. But I really don't know. I couldn't imagine not ever doing this type of job. I possibly would work, you know, with other sort of sectors, so maybe as a social worker or something like that. But I think they're all very similar roles.
Yeah, of course. That's brilliant. Well, Rachel, thanks so much for your time. Really appreciate it. All right, you take care.
Thank you. Bye.
Bye.